What are some of the reasons why people with glasses and contact lenses choose not to have refractive surgery? So I wanted to share some of the reasons that hold people back from having surgery and some of my thoughts on them. Eligibility, aka I may not be a good candidate for refractive surgery. When you walk into a refractive center, you will undergo a series of very precise diagnostic tests that will assess your candidacy, and your surgeon will let you know if you're indeed a good candidate for refractive surgery, and if so, which one. Cost. While the cost of refractive surgery may be a lot for many, especially if not helped with insurance, it's important to compare the upfront cost of refractive surgery with the long-term cost of repeated glasses and contact lenses, which can really add up over the years. In fact, as you would agree, if you recently purchased glasses, the cost of these glasses and contact lenses over the years ends up being more than the cost of refractive surgery itself. Fear. This is a big one. The idea of undergoing eye surgery can be really scary for many people. And honestly, I totally get it. And it's not just the fear of something going wrong or side effects after surgery. It's our own internal fear of whether we can be good cooperative patients during surgery. The truth is, there have been more than 50 million refractive surgeries performed worldwide, and over the years they have become so safe and standardized that under an experienced surgeon, the risk of complications is truly low. Never zero, but so low that it can actually be compared and even more safe than wearing contact lenses in a poor manner over the years. Long-term outcomes and stability. Some people are worried about the long-term effects of refractive surgery. The first thing is, if you're younger and your prescription and your vision is still changing and in a state of flux, you should probably wait till your prescription stabilizes over the years and then pursue refractive surgery. If your prescription has now stabilized, the rate of regression is about 1 to 2%, so quite low. Factors that influence this rate of regression are how young you were when you got the procedure or how high your prescription was. So the good news is that in the huge majority of cases, your prescription remains stable for many years after LASIK or SMILE or PRK. Even in those minority of cases where there might be a little bit of regression, a laser touch-up procedure can get you back to your best vision. Recovery time. So while the recovery time after refractive surgery is quite short, it can be still inconvenient for some, especially those with very busy lifestyle or jobs that demand an immediate return to the use of their vision. So while the vision is mildly blurry immediately after surgery, it clears up very quickly. And my patients are quite surprised when I tell them that when I operate on Fridays, by Saturday they can drive again, and by Monday they're back to work, back to life. Satisfaction with current glasses or contact lenses. If you're already content with wearing your glasses or your contact lenses and don't see the need to undergo refractive surgery, then amazing. So while there are valid and important reasons why some people choose not to have refractive surgery, for those who are looking for freedom from glasses and contact lens, I hope some of this information helps dispel some myths around this safe, painless, and life-changing procedures. Hope it helps. Take care.